Imagine walking into a pharmacy and getting a powerful antibiotic as easily as you can buy a packet of candies and gums. Sounds convenient, right? But convenience can come with a deadly cost. Hi, I'm Dr. Rehan Pradhan, MD Internal Medicine, and today we'll be talking about over-the-counter drugs. Are they your shortcuts to relief or free tickets to death? Watch till the end. This video might just save your life. Self-medication is on the rise. WHO estimates half of all medications worldwide are used inappropriately. In countries like Nepal and India, medication that require a prescription are handed out freely. No doctors, no diagnostics, and no instructions. Just a smile, some cash, and you're now experimenting with drugs that can potentially harm you than help. Many believe if a drug works for someone, it works for all. But medicine doesn't work that way. One person's cure can be someone's poison. Over-the-counter or OTC drugs are medications that you can buy without a prescription. They include paracetamol, painkillers, cough syrups, antacids, and some skin creams. They're considered safe only when used correctly and for their intended purpose. But even OTC drugs can cause side effects, interact with other medications, or be toxic in higher doses. Let's start with the usual one. NSAID or non-steroidal anti-inflammatory drugs like ibuprofen, diclofenac, and nimesulide are household names for headache, fever, and joint pain. But did you know their chronic use can lead to stomach ulcers, internal bleeding, and even kidney damage? In fact, they are the leading cause of drug-induced kidney injury globally. Interestingly, some NSAIDs used for headache can itself cause chemical meningitis and hence cause further headaches. There's a distinct entity named medication overuse headache. Sometimes you don't need more pills, but just reassuring words of a doctor. And then there is paracetamol or acetaminophen, perhaps the most trusted drug in the world. But even a slightly higher dose can cause liver failure. In fact, paracetamol overdose is the most common cause of acute liver failure in the West, and it's on the rise in South Asia too. Combining multiple OTC drugs like for fever and cough can lead to accidental paracetamol overdose. The basic principle of toxicology is dose makes the poison. Now let's talk about PPIs or proton pump inhibitors like omeprazole or pantoprazole. You probably know someone who pops one every morning for acidity. While short-term use is safe, long-term use without medical supervision is dangerous. Studies link their chronic use with fractures, chronic kidney disease, vitamin B12 deficiency, and even dementia. But the biggest ticking bomb is the antibiotics. From azithromycin to amoxicillin, antibiotics are sold over-the-counter like candies in our part of the world. No test, no proper indication, just a cold or a cough, and here, take some antibiotics. But guess what? Most upper respiratory tract infections are viral infections, and antibiotics don't work against viruses. Your body is usually able to get rid of these microbes within a week. The rampant misuse of antibiotics is giving rise to a monster we cannot see, but should deeply fear about: antimicrobial resistance or AMR. To put it into simple perspective, bacteria are evolving to resist our strongest defenses. According to the World Health Organization, antimicrobial resistance could lead to 10 million deaths annually by 2050, surpassing cancer as the leading cause of death. Imagine ending up in the ICU with a bug resistant to all antibiotics, all because of unnecessary antibiotic use for a common cold. World AMR Awareness Week, which takes place annually from November 18 to 24, is a global campaign to raise awareness about antimicrobial resistance and promote the responsible use of antibiotics to prevent the spread of drug-resistant infections. The theme for 2025 is Act Now, Protect Our Present and Secure Our Future. In developed countries, getting antibiotics without a prescription is nearly impossible, but in many nations like ours, pharmacies operate more like general stores. And let's not forget about steroids like dexamethasone or prednisolone. They are life-saving in severe asthma or autoimmune diseases, but taken randomly for skin condition or pain, they can suppress your immune system, raise blood sugar, cause muscle wasting, and even psychiatric disorder. In the United States alone, more than 100,000 people end up in ER every year due to adverse drug reaction from unsupervised use of medications. Commonly used drugs can cause sudden cardiac death and fatal skin reaction like Stevens-Johnson syndrome. Some of them are unpredictable, but yet most of them are preventable from proper medical evaluation. For safe use of OTC drug, topical NSAID use are safer options than tablets for localized pain. Taking paracetamol is relatively safe, provided you know the limiting dose of the drug. Taking 1 or 2 painkillers or antacid for acute pain relief is acceptable if you intend to visit your doctor after the use. Besides these, any other situation or medication is not safe at all. So what can we do to ensure the proper use of OTC drugs? Public must be aware that just because something is easily available doesn't mean it's safe. Policy enforcement is needed in the form of strict pharmacy audits, prescription monitoring, and clear labeling. FDA in the United States and DDA in Nepal regulate OTC drug use to ensure proper labeling, dosage, and safety. There should be rational use of medication. Take medications only on a doctor's advice. Use pharmacy you trust and avoid shady online sellers. Avoid pressurizing your pharmacist. Don't ask for strong antibiotics for a simple cold. And ask questions, discuss about drug interactions, past allergies, and relevant family history. Dispose unused medicines safely. Read the labels carefully and follow the recommended dose and timing. It's tempting to take shortcuts when you're in pain, anxious, or just desperate for relief. But there's no safe shortcut for good health. Over-the-counter drugs may seem like a quick fix, but when misused, they're poison. They lead to antibiotic resistance, higher adverse drug events, delayed diagnosis, and enormous public health costs. Let's spread awareness, demand better policies, and use medicine wisely, not just as free tickets to death, but as tools for better health. Share your experience about pharmacy shopping in the comments below. If you found this video helpful, give it a thumbs up and subscribe for more contents ahead. Stay wise, stay healthy, and I'll see you in the next video.